Minister, when you first started into politics, you were environment minister, and it strikes me that perhaps the first glimpse that the public at large got of you was as the guy who was able to broker a deal to end a blockade out at Pictou Landing First Nation. Very contentious issue and a lot of competing voices. And I don't see that as being completely dissimilar from where you are right now. You know, you've got various parties, your department, the general public, Doctors Nova Scotia, the Health Authority. And there are some very different views on how things ought to be done. There are some bad feelings between certain parties. And I kind of get the image of a whole bunch of kids at a junior high dance standing around the wall and nobody wanting being the first one to go in out onto the dance floor. How do you fix that? How do you, what can you as minister do? What do you think about as minister to try to get all of these parties together who need to work together if the system's going to get better? How do you do that?
I think you know, if it was easy, we wouldn't be having this conversation. But the reality is, much work is taking place. You know, things happen. Conversations are taking place between the various stakeholders, and good collaboration and progress on programs and evolving the way that practices take place within the system are taking place and do take place as part of regular business. And I think sometimes that gets lost in situations that come up and dominate the public or the news cycle of individual instances and experiences, even if they may be shared experiences. But what gets lost in that are the good work that are taking place, and the fact is that yes, disagreements and different perspectives and priorities exist out there, but that is the challenging part of my job and my responsibilities. I've got to look at the whole system. I've got to look at healthcare for all Nova Scotians from one end of the province to the other, and work with those providers, you know, within the Department of Health and Wellness, working on the policy positions to set the stage for where we're advancing and how we're going to operate, and the NSHA and the IWK as our delivery arm of providing those healthcare services to Nova Scotians throughout the province, and all of the partner groups that we would have in communities as well. So it is a challenge, but I don't want people to you know, I want to assure people that that work is ongoing, that we are having conversations, we are engaged with organizations, but there are different priorities at different times, but we are working to make progress on them with our stakeholders and our partners.